Hi, Dr. Gary Frenette here. And as you recall, you've already seen, I believe, the first chemotherapy video which we would recommend, and that's a general chemotherapy video. In that video, we talk about some of the commonalities that all treatments share and how you can anticipate and react to some of the potential issues you might face. However, as we mentioned, there's about 75 different medicines that we call chemotherapy. And we now wanted to produce a video speaking to you about the specific medications you'll be taking. In this video, we're going to discuss several issues with regard to that treatment. How do those drugs work? How are those treatments administered? What is the schedule of treatments? And we'll go into some of the potential reactions you could have to that treatment and how you can adjust to them. As always, whenever you have any questions, you should call your healthcare team if there's ever an issue. But by watching these videos, you may be better able to anticipate and prepare for some of the rare side effects that can happen. So as you can see here, we're actually within a chemotherapy treatment room. And we have chemotherapy chairs where you can sit and even lie back. There's TVs and internet access so that you can be entertained. And we'll also allow you to have a family member with you or a friend with you during your treatment. The specific number of treatments and the regulations, such as how old they need to be, will be discussed with you with your healthcare team during your chemotherapy teaching session. These videos, for example, are meant to supplement but not to replace that specific interaction you're going to have with us prior to your treatment, so you'll be able to get all your questions answered. During this video, what we'd recommend, as with the first video, is that you write down any questions you might have about your treatment, and then we can discuss those specifically when you come for your appointment to make your appointment more productive and to make sure all your questions have been appropriately addressed. There are some issues that you might imagine come about when you're getting chemotherapy treatment that I'd just like to discuss briefly. And as you can tell, we're in a large chemotherapy treatment room. That's done on purpose so that the nurses can have visual access to you during your treatment. If there are any unfortunate reactions or problems that you're having, we can recognize those immediately. Because it is an open space though, we usually ask that patients refrain from wearing heavy perfumes or colognes. Although you may not be bothered by them, other people may be more sensitive to smells during that treatment and therefore would appreciate you wearing as little perfume or cologne as possible. Likewise, oftentimes patients will bring snacks or food into the chemotherapy treatment room, which is completely reasonable and appropriate. But we'd ask that they not be especially strong smelling because, once again, some people can develop an aversion to strongly smelling food during their treatment. And so as a courtesy to others, we would ask that you try to respect that during your treatment. In addition to the TV, for example, or computers, a lot of times people like to listen to music or other audible entertainment. Because other people may be trying to rest, it's always a nice idea to bring headphones or something like that into your treatment room so you can enjoy the music or the TV at the volume you like without having to worry about disturbing others. The next portion of the video is going to be a slide presentation of your specific chemotherapy treatment. Make sure you have a notepad with you and jot down any notes or questions you might have or that the slide presentation generates so that we can answer them during your in-person visit with us afterwards. This video represents the views of Dr. Gary Frenette and not any clinic or hospital system. It's designed to supplement, but not replace, the written and verbal information provided to you during your teaching sessions. It reviews common trivial side effects, as well as rare but life-threatening complications of therapy. Today we're going to talk about the TCH chemotherapy regimen consisting of 3 drugs, Taxotere, carboplatin, and Herceptin chemotherapy. First, to best understand how chemotherapy works and why we're recommending this therapy, we're going to need a brief refresher on biology. Don't worry, we're going to keep it basic. Remember, all living things are made of cells, and the blueprint for how a cell in our bodies are made is encoded in a molecule called deoxyribonucleic acid, otherwise known as DNA. Here's a brief video showing this concept. So cancerous tumors are characterized by uncontrolled cell division. Both normal and cancerous cells divide by going through something called the cell cycle. The cell cycle goes through the resting phase, through active and growing phases, and then to mitosis or cell division. The ability of chemotherapy to kill cancer cells depends on the ability to halt cell division. When the cancer cells are unable to divide, they die. Chemotherapy kills cancer cells more effectively than normal cells since the cancer cells divide faster. They therefore do not have a chance to repair themselves prior to cell division. We're going to show the cell cycle in the next video. So therefore, the scheduling of chemotherapy is set based on the type of cancer, the rate at which the cancer cells divide, and the time during the cell cycle at which a given drug is likely to be effective. That is why chemotherapy is typically given in cycles. Cycles are simply treatments which are separated by time intervals. During this time, the cancer cells die while the normal cells have time to heal. When the healing of the normal cells is not completed, side effects occur. Normal cells, most commonly affected by chemotherapy, include blood cells, the lining of the stomach and the colon, and hair follicles. This accounts for common side effects which can include low blood counts, mouth sores, nausea, hair loss. Let's talk now about Taxotere or docetaxel. Taxotere belongs to a class of chemotherapy drugs called the plant alkaloids. Taxotere is also known as an antimicrotubule agent or a spindle fiber inhibitor. Spindle fiber inhibitors, such as Taxotere, inhibit the microtubule structures within the cell. Microtubules, or spindle fibers, are part of the cell's apparatus for dividing and replicating itself. Spindle fibers help separate duplicated DNA into each dividing cell. Taxotere inhibits this activity, thereby killing the dividing cancer cell. We'll take a look at the action of spindle fibers in the next video. Carboplatinum is an alkylating agent and binds the DNA in the cancer cell during the resting phase. Normal cells can repair this damage, but cancer cells divide quickly, attempt to replicate prior to repairing the DNA, and this results in cell death. Herceptin or trastuzumab is a monoclonal antibody, and this is an antibody that targets a protein on the cancer cell surface called HER2 or HER2/neu. In about 20 or 25% of the breast cancer patients, this protein is overexpressed on the cancer cell, and it leads to uncontrolled proliferation of the cancer. Herceptin binds to the HER2/neu protein, which prevents it from sending its growth signal to the cell nucleus. The cancer cell is highly dependent on the growth signal and dies when it's blocked by Herceptin. Your own immune cells may also help kill the cancer cell after recognizing Herceptin on the cell surface of the cancer cell. The next video shows this schematically. So as you'll see, the HER2/neu target is on the surface of the cell, and it dimerizes or couples with another protein, and at that point sends its signal for cell growth to the nucleus. Here we see the HER2/neu combining on the cell surface and sending its signal for growth to the cell nucleus. This is the process which Herceptin specifically blocks. Let's now talk about the TCH chemotherapy schedule. As we've mentioned, all three drugs are given by vein or intravenously or IV on the first day of the treatment. Herceptin is given alone on the second and third week of the treatment. After 6 total cycles of treatment are completed, the Herceptin is continued every 3 weeks for 12 additional treatments. Anti-nausea medications are given by vein prior to the administration of TCH chemotherapy, but generally are not required prior to Herceptin alone. The TCH regimen takes about 5 hours to deliver. Herceptin alone can be given in a much shorter period of time. A steroid, such as dexamethasone or Decadron, is given on the day prior to chemotherapy, the day of chemotherapy, and the day following the TCH chemotherapy. It helps to decrease fluid retention from Taxotere as well as allergic reactions. The dose is usually 8 milligrams twice a day. Growth factors such as Neupogen or Neulasta will be given under the skin subcutaneously to help your white cells and immune system recover more quickly. This is a somewhat complicated regimen, so we've made this graph to make it a little simpler. As we mentioned, Decadron or the steroid is started the day prior to your chemotherapy administration. The chemotherapy, namely the TCH chemotherapy consisting of all three drugs, is therefore given on day 0. The day after your chemotherapy treatment, a Neulasta shot is given to help your white cells recover more quickly. Herceptin, the antibody alone, is given on days 7 and 14. It is repeated, as you can see, every 21 days for 6 cycles. After the cycle of TCH chemotherapy is completed, we then give Herceptin alone. That schedule is changed to once every 3 weeks, and a total of 12 treatments are given, therefore over 36 weeks. Let's talk now about infusion reactions, or reactions that occur while you're receiving the TCH chemotherapy. These can occur with Taxotere, more rarely with carboplatin or Herceptin. The reactions can be notable for flushing, shortness of breath, palpitations, or lightheadedness. Most reactions are mild, but very rarely they can be serious or life-threatening. For that reason, you'll be closely watched during the initial portion of your treatment. Infusion reactions are reduced by dexamethasone, and other drugs such as antihistamines may be added as needed. Now let's talk about side effects of chemotherapy, namely TCH chemotherapy, that can occur after you've received the medication in the office. Remember, most importantly, that each person's reaction to chemotherapy is different. Some people have very few side effects, while others may experience more. The side effects described here won't affect everyone who has TCH chemotherapy. Heartburn often feels like a pit in the stomach or even nausea, and that can be treated with medications that block acid secretion into the stomach, such as Pepcid. Constipation or diarrhea can occur. Diarrhea is more common with this regimen and can be treated by eating soluble fiber, the BRAT diet, namely bananas, rice, applesauce, and toast, or antidiarrheal medications. Herceptin can rarely cause decreases in heart function or the pumping action of the heart. Your heart function will be measured prior to starting therapy and every 3 months or so thereafter. Muscle pain or headaches can occur with Taxotere or Neulasta. These can usually be treated with pain medications over the counter. Rarely it may require a stronger medication. Hair loss will occur about 2 to 3 weeks after initiation of the treatment. Loss of hair on the head occurs first, but eyebrows, eyelashes, or pubic hair can be lost as the treatment proceeds. Your hair will grow back at a normal rate after treatment, but it may have a different color or texture. The cost of your wig may be covered by insurance. Now, notably, when you're receiving the Herceptin alone as opposed to the chemotherapy and the Herceptin, your hair should grow back at its normal rate during the time you're getting treated every 3 weeks with the Herceptin antibody alone. Nail changes can occur with Taxotere. There are conflicting data whether placing fingers in ice during treatment to help alleviate this issue is of benefit. Maintain good nail hygiene and avoid false nails. Gloves may help protect nails during work or during mouth sores, as well as nasal tenderness can occur and can be minimized with mouth rinses or non-alcoholic mouthwashes. And as we mentioned, blood counts, especially white cells that help you fight infection, are reduced with this regimen. This usually occurs about 5 to 7 days after treatment are given, and you should report any fever greater than 100.5 or shaking chill to your healthcare team. As we've mentioned, you'll be given shots to help promote recovery of your immune system called Neulasta. Nausea is usually mild with this regimen and occurs about 6 to 48 hours after treatment. You'll be given anti-nausea medications by vein prior to treatment and by mouth as needed thereafter. TCH chemotherapy can also affect fertility. Talk to your healthcare team if that's an issue for you. During chemotherapy, you should practice adequate contraception. Numbness of the hands and feet can occur, especially due to the effect of Taxotere or docetaxel on nerves, and this is called peripheral neuropathy. You may also notice that you have difficulty buttoning shirts or putting in earrings. It's important that you report these symptoms to your doctor, as they may be controlled by slightly lowering the dose of the drug. The side effect usually improves slowly a few months after the treatment is completed. Carboplatin can also lower your platelet counts and slightly increase your risk for bleeding. Your platelet count, however, is going to be followed very closely during your treatment to minimize that risk. You'll receive one or more medications for nausea by vein prior to your treatment, and also receive prescriptions for anti-nausea medications to take by mouth as needed. If you do experience nausea at home, take these medications early and don't hope that it will get better without treatment. However, since they can cause constipation, you may need a mild laxative, for example over-the-counter Miralax, to help combat that side effect. Medications that you may receive as an outpatient include Zofran or Ondansetron. You should take one tablet every 8 hours as needed for nausea. This medication does not cause drowsiness and can be a good choice during the day when you want to stay alert. Phenergan or promethazine is taken every 6 hours as needed for nausea. This medication can cause variable drowsiness in people, so be aware of this. Ativan or lorazepam is taken every 6 hours and almost always causes sedation. This can be a good choice at night when you want to get some rest. Now let's review some common questions with regard to TCH chemotherapy. First, can I drive to my chemotherapy treatments? We like you to have a driver for your first treatment. If you receive drugs such as antihistamines that cause sedation, you may also need a driver for subsequent treatments. Will I gain weight with steroids such as dexamethasone? These drugs can cause fluid retention and increased appetite in some patients. Be aware of your food intake as well as the quality of food you're eating. For example, avoid excessive desserts or salts, etc. Can I get manicures or pedicures or massages? Manicures and pedicures are usually discouraged during aggressive TCH chemotherapy, but they may resume once you're on the Herceptin therapy alone. Avoid harsh skin scrubs if you have skin sensitivity on the palms or soles of the feet. You may also want to bring your own tools and avoid cutting cuticles. Massage is usually very helpful, however, during treatment, but avoid deep muscle massage if your platelets are low. Remember, platelets are the cells in your blood that help your blood clot. Are there any food restrictions? Avoid uncooked fish, meat, or eggs. There are no restrictions regarding fresh fruit and vegetables. Simply wash them as you normally would before eating them. You may find you prefer cooler, lighter foods and meals during treatment. Smoothies with protein supplements, for example, can also be a healthy, attractive food choice. Can I exercise during chemotherapy? Absolutely, and we strongly recommend that you do so in order to maintain your strength and endurance during treatment. You should pace yourself, of course, especially on your slow days, and stop when you become fatigued. Should I change my diet to avoid cancer in the future? We'll discuss dietary changes, but you may find only certain foods appeal to you during treatment and that your sense of taste has changed. Start slowly with any dietary changes and focus on healthy, non-processed foods. Should I take anti-nausea medications at home after my treatments? This is often necessary, as we've heard, and recommended as a preventative measure, and we'll review this with you once again during your office visit. How will I feel during my Herceptin treatments? During this time, your hair will grow back and your strength and endurance should improve. Many patients feel essentially normal during this period. Can I take my regular medications? Unless you're informed otherwise, continue your current medications as prescribed by your physicians. Should I take vitamins and supplements? There can be significant interactions between supplements or vitamins and chemotherapy drugs. Please assemble, therefore, a list of all the vitamins and supplements you're taking. In general, we strongly prefer that these be stopped until after your chemotherapy is complete to avoid any potential interactions or side effects. They can usually be resumed safely after therapy is completed. Do I need a port or intravascular access device? Although we can often treat intravenously by simply inserting an IV catheter into the arm, ports are required for continuous infusions of drugs or poor or limited venous access or when the drugs are irritating to the veins. We'll provide a brief video at the end of this summary to show an overview of ports for chemotherapy administration. So in summary, TCH chemotherapy is effective medicine because there's a therapeutic window. In other words, The TCH chemotherapy is specifically designed to be toxic to cancer cells while your normal cells have the ability to recover from the treatment. The chemotherapy treatment and supportive medications such as anti-nausea medications or shots to help your immune system are delivered at specific times during each treatment or cycle. The side effects from chemotherapy are generally mild, self-limited, managed with medications or behavioral changes. Severe side effects are very rare. Most importantly, if you have any questions or concerns regarding your therapy or the symptoms you're experiencing, please call your healthcare team. It's really what we're here for. Well, I want to thank you for watching the second video today, and I hope you've written down all your questions so that we can address them during a personal visit with your healthcare team, what we call a chemotherapy teaching session prior to your therapy. That way, I'm very confident that you're going to be comfortable with your treatment and be able to anticipate any issues that arise. As always, however, if something unexpected happens, I want you to feel very free to call us at any time for any reason so that we can address any concerns you might have. My friend and colleague, Dr. Eric Wang, is now going to briefly discuss the use of venous access devices, or portacasts as we sometimes call them, in the use of chemotherapy. Not everyone who receives chemotherapy needs a portacath, but for example, those patients with poor access to veins in their arm, or patients who require continuous infusions of chemotherapy over 1 to 2 days, will be benefited by the use of these ports. With these ports, you can swim, you can shower, and perform other activities as he'll now discuss for you. So move ahead to the next section of the video if you think you may want to learn more about these devices, or if you believe you're a candidate for these.
Welcome. I'm Dr. Eric Wang, interventional radiologist with the Vascular and Interventional Specialists of Charlotte Radiology. Your healthcare provider has ordered a port placement for you. I'm here to review this procedure and to make you and your family members feel at ease. A port is a small device used to obtain safe and reliable access to administer IV medications, such as chemotherapy drugs or antibiotics, and also used to obtain blood samples. Port is a small device, as I mentioned, and is about the width of a quarter and less than ½ an inch thick. The port is implanted underneath the skin surface at the chest, a few centimeters below the collarbone, and this tubing is then inserted into a neck vein. Most patients are relieved after they have had their port placed that they no longer have to be stuck multiple times in their arms to get IV access. The port, once healed, is relatively unnoticeable and requires very little care. Patients resume their normal daily activities. This can include taking baths, exercise, and even swimming without worrying about the port. During your port placement, you'll be taken to an interventional radiology suite, where sophisticated X-ray equipment will be used for safe placement of your port. A technologist will then use special soap to wash the upper chest and neck, and then a sterile drape will be placed over the skin surface in order to provide a sterile environment to decrease the risk of infection. Once you are prepped, the nurse will give you sedation through an IV, and I will give you local numbing medication at the skin access site. A small pocket is created at the upper chest level, and then a catheter is placed under lifetime X-ray guidance into a neck vein. Once the port is placed, the pocket will be closed in a couple layers of absorbable suture, which will heal on its own. You will then go to the nursing recovery area and rest for about an hour prior to going home. Thank you for allowing Charlotte Radiology to be your healthcare provider. Please do not hesitate to ask additional questions during your visit.